vaccination trial used by mothers attending AHC and also vaccinating their kids. So what we have done is to take two powerful technologies of our time, that is the barcode, and turned this card into a community mobilization tool, a very powerful incentivization tool for mothers and generally families that actually are vaccinating their kids. One would probably ask, why is it so challenging to have mothers vaccinating their kids? The reality on the ground is that vaccination really socially is not that strong, but technologically it's pretty much strong. So mothers find it hard to trade off the little money that they have to actually take a child who is not sick yet to hospital, and they had rather use those resources to do something else. And so we thought that rather than have them get handouts in terms of support, that we could actually incentivize them in ways that also support other community businesses. And so we developed that, and with time we also had a special voucher that mothers actually get, and they get discounts on this whenever they visit partnering agrobeds and other shops there that are related to agricultural production. We are hoping then that this technology with time is going to expand to other partners as well beyond the agricultural sector, probably even have corporates coming in and really helping us support mothers with incentives that enable them to actually have livelihoods that are much stable, livelihoods that are productive, and so on and so forth. So the mother then just takes this card and to the point of sale, and at that particular point it's verified. And that particular negotiated or pre-negotiated discount is issued on certain goods that the mother would be interested in having. Now, this card, in terms of the metrics, is that we saw initially that it increased and improved vaccination rates from 55% to 95% in areas that we were trialing. At some point, we looked also at the number of newborns that were brought in for their first vaccination. Now remember that in such remote places, mothers end up giving birth at home. And so these children never quite make it on time to a vaccination center. And so we saw an improvement in the number of kids that were brought in for their first vaccines, that is the BCG vaccine, from 20 to about 65%, and that was really significant to us that we could actually coax out these mothers to actually come and become visible, really, to the community and, of course, to the government and other authorities as well. Well, when we were piloting this innovation, our scope was pretty limited by the area in which we operated, but we were able to reach over 2,000 kids within a very short span, about 9 months or so, and about 700 pregnant mothers who showed up to use this technology. But overall, in terms of households, we reached close to 9,000 people who actually benefited directly or indirectly. Now, I would like to mention at this point that the technology is not just limited to mothers and kids. Like I said, it galvanizes a community into action. It makes the community want to participate. And so what we did at some point was also to incentivize community champions. Yeah? Individuals that would actually spot these mothers in hiding somewhere or in their homes and be able to ask them to come get the vaccines that they need. And so adding on these extra partnerships like the community champions that include the community health workers, TVAs, and also just the local leadership, we were able then to reach a lot more people, and the message was able to penetrate to the very grassroots of